Demonized and suppressed by the war on drugs, psychedelic medicines are making their return, and we're here to bring you the latest in scientific research and therapeutic practices involving psychedelic medicines from psilocybin to ayahuasca to DMT and beyond. This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and this week we're going to be discussing ketamine for alcohol use disorder with Dr. Stephen Mandel. Dr. Stephen L. Mandel is an internationally recognized expert and pioneer in the use of ketamine infusion therapy to treat mental health disorders and chronic pain. Dr. Mandel has more than 40 years of experience utilizing ketamine as a board-certified anesthesiologist. He also earned his master's degree in psychology. He is the founder and president of Ketamine Clinics Los Angeles, a leading ketamine infusion therapy clinic in Southern California. Dr. Mandel is also founder and first president of ASKP3. Now, before we get to our discussion with Dr. Mandel, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, if you are a clinician like Dr. Mandel and you would like to learn more about how psychedelics can help your patients, please check out the Psychedelic Medicine Association. It is our mission to get you educated so you feel comfortable having these discussions because, you know, after How to Change Your Mind came out on Netflix, I'm sure you've seen more and more patients showing up asking questions about psychedelics, and we want to help you be prepared to have those discussions confidently. So please check out the Psychedelic Medicine Association at psychedelicmedicineassociation.org. Now, without further ado, thank you so much for joining us again today, Dr. Mandel.
Lynn, it's very happy to visit with you again. Thank you for having me.
Dr. Mandel and I were just chatting that he was one of my first guests about 3 years ago. And so it's been a while, but I'm so excited to have him back, especially because we were talking about ketamine kind of in general before on our last episode. And we'll put a link to that in the show notes if you want to check that one out. But now Dr. Mandel is here to talk to us about a very specific use of ketamine, and that is ketamine for alcohol use disorder, which I know is something that he has been using to treat with his patients. So Dr. Mandel, if you could start off and tell us a little bit about research that's been done involving using ketamine to treat patients that have alcohol use disorder, and maybe even a little bit of background on what alcohol use disorder is.
Well, alcohol use disorder is the chronic, recurrent, almost obsessive use of alcohol for comfort or refuge or self-treatment. We treated a man from Dallas, a very advantaged man who had at least a fifth of bourbon a day for about 27 years when he came to us. And he had also been to just an enormous array of highly regarded interventionists of various kinds. And the common wisdom was you don't start treating alcohol use disorder while people are still actively drinking. That was not an option for him. He said, I'll do anything you need me to do to facilitate my getting well, except stop drinking. And he was an heir to a substantial oil fortune, and he had a lot of resources, and he'd come from Dallas, and he was not going to do this. The psychiatrist really leaned on me, and I said, okay, we'll give this a try. And we started with ketamine. This was in 2019, and I checked with him last around Christmas. Long story short, he has not had a drink since his treatment, and his family is no longer incredulous, but still like they think it's some kind of miracle. It's not a miracle. It's just really attentive care to a variant of OCD.
That makes sense. And can you tell us a little bit about the research that's been done specifically on ketamine for alcohol use disorder?
there are two big articles, both from 2020, that review the mechanisms of action of ketamine and the mechanisms of action of alcohol use disorder, and find glutamatergic transmission and nucleus accumbens as a locus very prominent in them both. Uh, and in both, the um, the initial activity is potentiation of the glutamate by uh, inhibition of the NMDA receptors. And then I said inhibition, I meant potentiation by inhibition of the receptors. And with chronic use, it turns out of both ketamine and of alcohol, there's a reverse process by which there's a receptor desensitization and probably decrease in receptor population with chronic use. And some researchers have wondered, it's always perplexing to people who talk about ketamine as a very profound therapeutic agent. Well, how come the same stuff seems to be addictive? Now, of course, we know ketamine is not addictive in the classic sense. It doesn't produce dependence. It doesn't produce withdrawal. It does produce the same kind of bad choices in some patients that alcohol does, although alcohol has a physical withdrawal. Uh, and I think it's a matter of set and setting, and I think there's a tremendous overlap in the neurobiology, but it's not identical. And the use of alcohol is profoundly disruptive to people's lives when they start to become dependent upon it rather than just use it as a social lubricant. How some people are able to manage large amounts of social lubrication and not go over into what we call abuse and what it disrupts their lives is perplexing. Is it in the genes? We do know there's some curious little hints. Um, Even in rats treated who are habituated to alcohol and then treated with ketamine, there's a gender difference. And the male rats really respond well to ketamine treatment in terms of really reducing their intake of alcohol. The female rats, not so much.
Oh,
Go figure.
interesting. And has the same thing been studied in humans and have those same patterns shown up?
Yeah, but the it's hard to control humans quite so tightly as you can rats. They have other agendas, and they're much more assertive than rats, actually. So the answer is there's a suggestion of that, and we don't really have data.
There's a suggestion that it works on men and not women, or there's a suggestion that ketamine works to address alcohol use disorder?
Ketamine definitely works to address alcohol use disorder. The distinction between men and women is not so clear in humans as it seems to be in rats.
Gotcha. I understand.
By the way, just by way of history, ketamine was approved as an anesthetic in 1970. And its first major use, I mean widespread use, extensive use, well-reported use outside of the operating room for anesthesia, was by Krupitsky in Moscow in a government program treating chronic alcoholism. That was the first behavioral use of ketamine. And it was profoundly effective. He had an amazing program and really took confirmed disabled, alcoholics who were disabled by their alcoholism and got them abstinent And his endpoint was abstinence for a year, and he was successful. And the only reason the program didn't continue was political, having nothing to do with the results or the costs. It was very cost effective. Alcoholism is a terrible problem in that country. I don't know if it is today. We don't know much about what goes on in that country today. But now, in retrospectively, we have a lot of information about widespread disability from over reliance on alcohol in the Soviet Union, in the time of the Soviet Union. And this really impacted those who had the good fortune to be in his program in Moscow.
Very interesting. I did not know that. Could you talk a little bit about your thoughts on, you said that the mechanism of how ketamine works there's some overlap with how alcohol works on the body. But for ketamine to so effectively help people get off alcohol, do you think it is a purely, cell-based anatomic interaction, or do you think some of the more kind of, I don't know if I should say psycho-spiritual aspects of ketamine, but do you think that some of those aspects have anything to do with it as well?
I think they have everything to do with it, Lynn. Oh, for sure. Yeah, that's really important to emphasize. This is an enabler, a fueler. It's not a cure, and it has much more, gives you much more oomph than it does direction. Ketamine, that's why we don't see such great therapeutic results in the bar room or in the alley or at the rave. And they say, well, it's the same stuff. How come? Well, you don't see the same results. Never mind. It's not a matter of the substance. The substance is a tremendous facilitator. It needs guidance, and the people taking it need guidance. And we have a 5 point program in our clinic, and there are other programs, but we found that's very effective. Uh, we start with sleep. Sleep is super important. This is not just for alcohol, but I'm speaking of alcohol, but I'm also speaking of depression and suicidality, to a lesser extent, PTSD. We start with sleep, huge amounts of effort in sleep hygiene. It's very important and very understudied. It's key to a lot of the mood disorders or to exacerbating them. Then we go on to nutrition. Nutrition really matters. The old Egyptian physician, I mean, like 2 millennia old, saying that you know 1/3 of your food helps you and 2/3 of it help your doctor. I mean, we eat too much of the wrong things, and it really impacts us. I'm not going to get on a rant in this conversation, but um, we get all of our information, at least in our country, almost all of our information from people who want to sell us things. And the people who want to sell us drugs or medicines tell us what they want us to know about that. And the people who want to sell us foods tell us what they want us to know about those. There's ample information about both food and medicine that's out there that's easily verifiable, that suggests alternative paths. And nutrition really makes a difference. After sleep and after nutrition comes exercise. This is not training for the Olympics or seeing if you can look like Schwarzenegger used to look. This is about balance, range of motion, some strength, but more agility and some stamina. You've got to exercise. Walking is super important. Swimming, any whole body, non high impact, sustainable for 20 or 30 minutes, and not 40 minutes every other weekend. The weekend warrior, it's really great. It's not good for what we're talking about. It's got to be part of your daily life. An intimate interpersonal relationship. It doesn't have to be a physical intimacy, but a real trusting, mutual trusting and feeling of caring, you for the other and the other for you, is an tremendous facilitator of this medicine. And lastly, but importantly, is talking therapy. There's a lot of varieties of talking therapy. There's a lot of talk about which is better than which. Any of them practically are better than none of them. And, we get people in the clinic who do fabulously, and 6 weeks later they need boosters. And we get people in the clinic who do fabulously, and they're doing fabulously 6 months later, maybe with one pair of boosters. The difference is whether they incorporate these 5 aspects of wellness into their lives.
That's really helpful to know. Thank you for illustrating those. And speaking of, you had this point protocol for outside of ketamine. Can you talk a little bit about the protocols with ketamine that you have found effective with your patients who are using it to address alcohol use disorder?
We have we use our depression protocol, which is high dose intravenous, um, 3 infusions a week for 2 weeks, or 2 infusions a week for 3 weeks. This is, in my opinion, this is not for lozenges. This is not for cap. This is for intravenous, high dose, concentrated therapy. If there is a coach or a therapist, it's ideally coordinating the infusions with the therapeutic sessions so they happen a few hours to a day afterwards. The ketamine really opens a window. It starts a neuroplasticity. We talk about NMDA, and we talk about AMPA, and we talk about BDNF. I think these are all important, and there's a tremendous focus of research on them. My personal suspicion is that ketamine is acting, and most of the psychedelics, the other psychedelics, are also acting um, in addition to that neurochemistry on a different level, on a network level. They're quieting the default mode network. They're rejiggering the connections among disparate, widely spaced foci in the brain that kind of run the show. And I don't want to disparage any of the research on the nitty gritty of NMDA receptors and the gates and all that. It's very important for getting the chemical into the nerve and getting the chemical across the synapse. But I think, big picture, something is going on another level that has a very profound effect. And that manifests in what patients call a window opening. And people say, oh my God, it's like I went to a car wash for my brain, or I got new glasses. And those new glasses get dirt on them again pretty soon. This is an opportunity to be seized upon. And in I can't tell you the interval, but it's no good right after. People have to kind of reconstitute to be able to put things together. That's why too much ketamine is no good, because they don't store what happened. Whatever happened is lost to them. So there's an upper limit to it. There's a sweet spot. But anyway, you infuse it the sweet spot. They need an hour or two to kind of pull themselves together, and then they're really ready to do the work. And that readiness reduces over time. And I would say by 72, 96 hours, they're getting too close to baseline for optimum exploration of what they got. Similarly, on the other hand, the people who are trying to do this medicine in conjunction with therapy simultaneously, are having to reduce their intake of ketamine in order to be able to maintain contact, in order to maintain a coherent dialogue with their helping person. And I think that limits the potential for opening that window. So doing it right at the time, not so great. Doing it a week later, not so great. Somewhere between an hour or two and 3, 4 days. There's tremendous opportunity for research there, but this is much more nuanced than we're really at a frontier here. It's just getting ketamine in people and seeing the transformation is amazing, and trying to sort out how to optimize it is we're not there yet.
That makes sense. And thank you for that description of all the factors that go into it. With people thinking about alcohol use disorder, I'm sure a lot of people have thought, does something like AA play a role in ketamine? And is that one of the things that maybe you should start in that window of time? Have your patients reported back on any use of systems like that in the after ketamine period?
AA is fabulous. And like we were talking about drugs before, or medicines and food, there aren't any touters. Nobody's making money on AA. So it gets a bad rap. Also, the old doctrinaire guys, and they're mostly guys, in AA say, oh my God, if you took a drug, you need to reset your birthday. Now, actually, that's not the official position of AA. And medicines used for therapeutic purposes, even mind altering medicines, are perfectly fine with the central office. You can check the website. Also, Bill Wilson, a founder, was profoundly impacted by LSD and thought it was amazing therapeutically and very much enthusiastic about it, to the point where, and this is more in the nature of rumor than knowledge, around the early 50s, while he was sort of emeritus as AA was evolving, they really leaned on him to shut up about LSD. Now, whether this is really true or not, I don't know, but he did. And it wasn't because he ceased to be enthusiastic. I don't know why it was. But anyway, AA and I'm sorry, ketamine and probably other psychedelics facilitates the transformation that AA is seeking, and the white light that they talk about in the big book. Some people say it's experiencing an encounter with a higher power, and some people think that higher power has to do with God or religion, although it's pretty clear that they mean a spiritual experience, not a religious experience, if you can distinguish the two. And they make it very clear that this transformation requires a spiritual experience, but not a religious experience. And it's pretty clear that Bill Wilson thought he was getting one from LSD.
There you
So
go.
I'm very much in favor of alcoholics. See, we're talking about alcohol use disorder as a disorder, and we treat it with ketamine. But there's a whole other population of people who are successfully abstinent, but are beginning to have cravings. And those people are so helped by a little experience with ketamine. Ketamine is amazing at helping people to resist cravings, giving them the spine, the cojones, the whatever you want to call it, to see past the moment and to see the consequences of the impulse, not to diminish the power of the impulse, but to put the impulse in context and choose to move on.
Very interesting. I like the way you've put that. As you had mentioned at the beginning, you had that patient who was actively using alcohol when beginning his ketamine treatment. Now that you've had that experience, do you suggest that most people who are coming to you for alcohol use disorder try to wean off alcohol prior, or like where ideally are patients starting to begin the ketamine protocol?
I'm going to tell you what I think, and it's based on my experience and my beliefs. It's not based on any good scientific data, and I'm really, really profoundly impacted by data, information, the truth. That is my mantra. Anyway, they should be abstinent and past the point where they would suffer uh, physical withdrawal problems. I would say that's about 5 or 6 days, but that's not a have to. And as I told you in this case, this guy would do anything I wanted him to do except reduce his intake below a forget whether it was a quart or it was not a fifth. It was a quart of bourbon a day. Uh, that's not so impressive. You can build up to a quart easily, but having built up to a quart over literally more than a couple of decades, and to be 3+ years with zero now, that's a testament.
Yeah, absolutely. Is there anything else before we wrap up regarding, ketamine's effect on those with alcohol use disorder, or other things that you recommend people who might be considering this for alcohol use disorder? Anything else you'd love to add?
Well, simply that they probably tried everything, and they probably have a lot of carnage in their lives. And whatever stories they're telling themselves about how scary this is or that they shouldn't do it, get over it and get help. And this is a really, really valuable adjunct to getting help. If you're coming here so you're going to get ketamine, so you're not going to take a drink, it's not going to work that well. If you're coming here as part of a program, you have a very good chance of being abstinent with all of the benefits that can confer. I would say this applies also to people with opiate use disorder.
That ketamine be part of a more comprehensive therapeutic program of some sort.
If you're substituting one substance for another, you're not going to be very happy. Neither is those who are trying to take care of you. Neither are those you're trying to protect from your impulsivity.
That makes a lot of sense. Well, Dr. Mandel, thank you so much for sharing. Again, as always, if you could let people know where to find you and your work.
Yes, I'm at Ketamine Clinics of Los Angeles. Uh, you can see us online at ketamineclinics.com, and you can find us via your telephone at 310-270-0625.
I love that. I think you're the first phone number to be given out on the show. It's old school and I dig it, Dr. Mandel. So everybody who's in their car, they can be like, hold on, pause, rewind, and they can just dial it from the phone. So amazing. Thank you so much for sharing that with potential listeners out there. And thank you so much for sharing your knowledge with all of us, and appreciate your many, many years of work in the field.
Well, thank you. I'm so glad we got to visit again.
Absolutely. All right. For everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review, as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.